When patients go for addiction treatment in the community, one of the problems that they may face is they may not receive evidence-based treatment on all fronts. For example, a lot of patients are not aware that there are medications that can assist them in their recovery, and they may be working with counselors who aren't all that aware about how those medications work either. This project is largely about building both patient and counselor awareness about how medications can fit into a patient's recovery. Not just medication for addiction, but also psychiatric medications, which a lot of patients need in order to maintain stability. So to address these barriers, the Patient-Centered Outcomes Research Institute has actually funded TRI to develop a counseling toolkit that will help counselors talk with patients, particularly patients with alcohol use disorders, to think about what their treatment options are when they enter treatment. So we're really excited about this because PCORI really focuses on trying to involve patients and providers in the research process from soup to nuts. They're going to help us with basically designing the curriculum, and then we're going to take their suggestions and feedback and translate that into a 4-volume graphic novel series that can actually be used in treatment groups at the beginning of treatment. So what will happen is counselors and patients will use this graphic novel series as part of the treatment process and sort of open up patient awareness about what their treatment options are, particularly around medications like anti-addiction medications and psychiatric medications. So if the project is successful, what we'll actually have is a curriculum that equips counselors to discuss patient-centered issues at the outset of care and involve patients in the decisions around their treatment. We've actually already had some success with similar type of curriculum in improving counselor adherence and kind of getting them to stick more to what some of the evidence-based concepts are around these issues. In this case, if it worked, the toolkit that we develop would actually be a step forward in enhancing patient involvement in some of the decisions that happen early in care.